Hey there, future doctors! Today, I'm diving into a crucial part of your anatomy studies, the axillary artery. Trust me, understanding this vessel is going to make your life in med school a whole lot easier. Let's get started. The axillary artery is a vital blood vessel that supplies the upper limb, chest, and shoulder. It begins as a continuation of the subclavian artery after it passes the first rib. From there, it travels through the armpit region, known as the axilla, and continues into the arm, where it becomes the brachial artery at the lower border of the teres major muscle. So, how is the axillary artery divided? It's split into three parts based on its relation to the pectoralis minor muscle, a key anatomical landmark. First, we have the first part, which is medial to the pectoralis minor. This part stretches from the lateral border of the first rib to the medial border of the pectoralis minor muscle. Its main branch is the superior thoracic artery, which supplies the upper chest wall, including the pectoralis muscles and part of the serratus anterior muscle. Next, the second part is located posterior to the pectoralis minor muscle. This section has two important branches, the thoracoacromial artery, which supplies the pectoral, deltoid, acromial and clavicular regions, and the lateral thoracic artery, which supplies the lateral parts of the chest wall and part of the breast. Lastly, we have the third part of the axillary artery, which is lateral to the pectoralis minor muscle. This segment extends from the lateral border of the pectoralis minor to the inferior border of the teres major muscle. Its branches include the subscapular artery, the anterior circumflex humeral artery, and the posterior circumflex humeral artery. The subscapular artery further divides into the circumflex scapular artery and the thoracodorsal artery. Now, I know that's a lot to remember, so here's a handy mnemonic to keep things straight. Screw the lawyer, save a patient. It stands for superior thoracic, thoracoacromial, lateral thoracic, subscapular, anterior, circumflex humeral, and posterior circumflex humeral. Understanding the axillary artery is not just about memorization, though. There's significant clinical relevance here. For instance, injury to the axillary artery can result in serious conditions like hemorrhage and ischemia of the upper limb, especially during trauma or surgery. Conditions like subclavian steal syndrome and thoracic outlet syndrome also involve the axillary artery and can lead to symptoms like dizziness and ischemia in the arm and hand. Moreover, the axillary artery plays a role in collateral circulation. In cases of arterial occlusion, such as peripheral arterial disease, its branches help supply blood to the arm, ensuring the muscles and joints receive adequate circulation. In conclusion, the axillary artery is crucial for delivering blood to the upper limb, shoulder and chest wall. Understanding its three parts and branches is essential for your medical studies and future clinical practice. So take your time, review this guide, and you'll be mastering the axillary artery in no time. Thanks for watching, and keep pushing forward in your studies.